So the next technique is Thermafil. So Thermafil basically is a patented endodontic obturator consisting of a flexibly central carried size core to match the standard endodontic files that are uniformly coated with a phase gutta percha. So basically, it's got a core material inside with a gutta percha surrounding it, and these come in various sizes according to the size of the last file that you have used. So first verification of the canal with a blank carrier. So the carrier is coated with gutta percha. So the carrier is checked. So for the apical end, and then a smooth insertion into a lightly sealer coated canal, and then cut back of the carrier, that is searing off of the carrier along with the gutta percha, and then vertically condensing the material. These are the Thermafil sized plus Thermafil plus gutta percha points. So this has got a core material inside and gutta percha around it. So binding of, so first the verifier is bound to the canal to check for a tug back and the apical size, and then adjacent or confluent size Thermafil carrier is used for searing of the GP. It is recommended that it should be preferably heated in the therma preparation oven at 115 degrees Celsius for 3 to 7 minutes, depending on the size, which ranges from 20 to 140. The gutta percha coating extends beyond the carrier by 1 to 2 mm. In this, the basic requirement is that a continuous taper is absolutely necessary. Plastic carriers are used nowadays, but they are relatively flexible. Smaller sizes of 25, 30, and 35 have been introduced as well. So these are the various sizes of Thermafil. This is the Thermafil oven in which it is heated before placement. So the servo made handle, which is later cut, and then a vertical condenser is used to condense it. So important points: in teeth with multiple canals, the other orifices must be sealed with damp cotton, or gutta percha may block the other orifices. So during obturation, if you're using a single cone for obturating and not obturating the other canal simultaneously, while searing off the GP, you may block the canal next to it. So that has to be taken care of. So you can also block it with Teflon. That is what I sometimes do. So the mishaps that can occur is if there is large zinc oxide sealer overfill, which must be avoided. So while trying to achieve a puff, excess sealer must not be pushed inside the canal. And so in this case, basically a root canal was done, and because of the sealer which went into the nerve, which caused paresthesia. So in such cases, you have to wait and watch and prescribe steroids. This can also be a permanent effect. So because this is a sealer, one of the ideal requirements of a sealer is that it should not resorb. So if it is non-resorbable, the sealer stays in the nerve, which could lead to paresthesia. Similarly, in this case, the mental nerve was blocked because of the sealer extrusion. So sealer does not have to be extruded, and a puff is not something you should achieve. It's like an outcome. It is not, you don't have to achieve it intentionally. Overextending of the obturation material. That is why a master cone and a tug back have to be checked. So while placement of the master cone, a tug back is absolutely necessary, because if the tug back is absent and you're giving vertical pressure while plugging the gutta percha, it may extrude, like in this case. The importance of root canal filling should not be diminished within the framework. The choice of the practitioners must justifiably be based on individual preference and particular practice circumstances.